Okay, the next presentation is one that the fire chief is going to give us. And fire chief, as you come up, I'll kind of introduce what we're trying to do here. All right, so there's been a lot of conversation out there on, as I call social media, and not always the best place to get information. So what I wanted to do is not interject anything more, but to basically hear it straight from the guy who's in charge of the fire department. Basically to talk about the fire department as it stands today, its rescue capabilities, how you do things that with the limited amount of resources that we're able to provide you, and what the citizens can look forward to. So, Chief, thank you for coming, and appreciate looking forward to your talk.
Very good. Mr. Mayor, members of council, Mr. Manager, I'd like to thank you for the opportunity to talk about our fire rescue department and the different organizations within and outside the city that respond seamlessly to provide the absolute best service we can for our citizens. Additionally, I'll talk about our prevention and education program, our training program, and how we respond to emergencies. I'll tell you a little bit about our past difficulties obtaining fully certified employees and what we, you, the city, have done and are now doing to attract qualified employees. Additionally, I'll talk about our current level of staffing and what we're doing to improve those levels. I'll talk about how our volunteers augment our response and what they do to, benefit our operations and the community. And last, I'll talk about our automatic mutual aid and the continual need for these services as we increase our staffing levels, and how this aid provides for the safety of our personnel, our citizens, and will help us in our next ISO review. Our prevention and education program includes efforts from both the career staff and our volunteers. These efforts include classroom talks and demonstrations, Fire Prevention Week displays, our fire inspection and fire prevention incident survey program, and safe house displays at various local events, just to name a few. Our inspections program is staffed by 3 career inspectors, 1 on each of our 3 shifts, and 2 volunteers who are certified inspectors as well, and augment our program when available. All 5 carry the Inspector Level 2 1031 certification through the Department of Fire Programs, and our fire inspectors are under the direction of a battalion chief. And I myself am also a Level 2 1031 certified inspector since 1988. The York, Poquoson, Williamsburg 911 Communication Center is key for our success in any emergency response. Keep in mind that this center is a model for communication centers across the U.S. And the concept of consolidating is saving communities millions of dollars a year. We currently have the most up-to-date communications equipment, to include the mobile data terminals that we have in our vehicles. In the past, on-scene tactical information needed to make the best decisions was minimal at best. But today we have this information at our fingertips. We continue with our police first responder program, and Chief Bowen is going to talk a little bit about that at the end of my presentation. He'll give you more details. The first responders are police officers that have obtained their EMT certification, and while on patrol in our city, can respond to calls for EMS and often arrive on scene first to provide basic care until our medic units arrive on scene to provide advanced life support care if needed. These first responders also help with preparing a patient for transporting and lifting assistance as well. Once dispatch receives a call for service, they gather the necessary information and notify our staff, usually within 30 to 45 seconds. Although you may stay on the line longer given additional information, we're already on the way. That's because we have two dispatchers, one that gathers information and another one that will dispatch us once enough information has been given. And we continually receive updates through the whole emergency. You have placed stations in the eastern and western end of the city, providing us with response times that's less than 5 minutes to 90 to 95% of our city. Our engine operators are assigned a piece of apparatus at the beginning of each shift. Our firefighters are given assignments as well, so everybody knows what their tasks are when they get on scene. All of our career staff, including myself and the deputy chief, is cross-trained in EMS. And EMT certification is the minimal accepted level for career staff, as is firefighter level 2 for interior firefighting. We currently have 8 EMTs, 15 EMT intermediates, and 9 EMT paramedics on our staff. Excuse me. Our career staff receives a minimum of 20 hours of fire training each month. That training is composed of classroom as well as hands-on training. All of our training hours are reported to the Department of Fire Programs, and we keep internal training records as well. EMS training is also provided so that each of our employees can receive their required certification hours while on duty. And these hours are reported to the Office of Emergency Medical Services, and we maintain internal records as well. Our training officer is certified to conduct all in-house training for both fire and EMS that both fire and EMS training is under the direction of a battalion chief. Our current staffing levels are 28 career firefighter EMTs. Not counting me and the deputy chief and our office manager. We have 3 shifts that work a 15-day cycle, 5 days on, 6 days off. That's a day on and a day off, a day on and a day off for 5 days, and then 6 consecutive days off. With 28 personnel, this provides us with 1 shift with 10 personnel and 2 with 9. This shift with 10 represents our latest effort to increase our staffing levels with a 3-year goal of 3 shifts of 10 and a minimum staffing of 8. Tonight, the manager will request that you authorize him to fill one of the federally funded positions that we applied for, but were not successful in obtaining through the latest SAFER grant. This will be the second of the 3 positions I just talked about. We will again apply for additional personnel once the grant opens again around next September. Once the 3-year goal is complete, we will reevaluate our staffing needs and make additional recommendations at that time. Speaking of grants, I want to say that we are very active in obtaining every grant we can get our hands on. We have been successful in receiving 2 FEMA fire grants. And if you know anything about those, you compete with many fire departments across the United States. We got one for turnout gear and another one for the self-contained breathing apparatus that we wear on our backs. We've received a number of rescue squad assistant grants, which is a 50-50 grant we have used to pay for half of a medic unit, and recently 2 LifePak 15 defibrillators. We've gotten 4 Port Authority grants, which included communications equipment for the Marine operations and personal protective clothing like the cold, foul weather gear. Our main fire rescue boat was obtained through grant, as was our last airboat, just to name the larger ones. And we apply for many smaller grants take advantage of any that we can get our hands on. When talking about staffing, I'd like to make a special point that this is the first time in the history of the department that our staffing levels have reached 30. We're very proud of this, but it hasn't been an easy road. As you're aware, we've had difficulty attracting candidates that had the necessary certifications for our vacancies. This was in part due to other localities having hiring processes at the same time as us, and they would get these highly qualified individuals. We found ourselves with vacancies we couldn't fill. Our short-term answer was to hire trainees and send them to obtain the necessary certs. This can be expensive, but it was necessary. But that's changing. Recently, we added 3 highly qualified individuals with years of service in the fire and EMS field from surrounding localities. So what changed? Just as we proudly declare to everyone that Poquoson is the place, we began to sell ourselves. We proudly declare that Poquoson Fire Rescue is the place to work. We sell what makes us special. The fact that you work for a department and a city where you're more than a number and where your contribution is appreciated. We talk about the benefits of working and hopefully moving to a community that's a safe place to work and raise a family. Additionally, we sell our benefits package that now includes health insurance assistance for retirees. Thank you. Our health insurance is fantastic. Our retirement is calculated on the 1.85 multiplier that you provided. And we've recently added 3 new designations, one on each of our 3 shifts, that we call the Master Firefighter, that provides the opportunity for additional advancement. We currently pay a stipend to our intermediates of $4,000 per year, and have recently increased that stipend for paramedics from $5,000 to $6,000 per year. I think we're on the right road for success. Now, I want to talk a little bit about volunteers, and I want to point out that we currently have 14 of our career staff out of the 30 that came from the volunteer organization. In the last 2 years, we've hired 4 of our staff from the volunteer ranks. So how do we integrate our volunteer staff responding to emergencies? All staff that arrives on the emergency scene, whether they're off-duty career staff or volunteers, report to the incident commander and receives their assignment. Some volunteers are certified as pump operators, and they may be assigned to this task to free up a career pump operator to fight fire. This is the most efficient way to augment our career staff with any additional staff, to include automatic mutual aid equipment and personnel. We appreciate and welcome all qualified help, and we have tasks that less qualified members can perform as well. Besides augmenting career staff during emergencies, what other services do the volunteers bring to the table? These volunteers accept donations and fundraise throughout the year, and much of that money comes right back to the community. A few examples of their support includes the dock and the covered boat slip at the end of Wren's Road, a full complement of rescue tools, every thermal imager that the department has ever owned, the Cub Cadet you see at the Seafood Festival, the brush truck, the tile floor at Station 2, furniture, exercise equipment, TVs, donations to our record-keeping software, and funding medics in whole or in part. Our record-keeping software that they helped to purchase when we added the MDTs in the equipment has reduced our turnaround at the hospital from an hour, hour and 15 minutes, down to about 30 minutes. That's 30 to 45 minutes quicker than before, and puts the medic unit back in the city ready for response sooner. and it's a huge deal. When you see our safe house at events, it's staffed entirely by the volunteer members. That include members from the volunteer fire, rescue, and the ladies auxiliary, and they do an excellent job. Now, I'll talk a little bit about mutual aid. Automatic mutual aid, this is a very important part of our response to large-scale fires and emergencies and key to the safety of our personnel and citizens. A large operation such as a working structural fire or commercial fire requires a lot of manpower. Many tasks must be performed, and some of those simultaneously. Ventilating roofs, gas and electrical cutoffs, laying of multiple lines of hose, entering the structure, having rescue lines and crews available, what we call our 2 in and 2 out. Safety officers, rehab, and backfilling stations, to name a few. You can easily see that these tasks can quickly tax our staff, and even as we begin to increase our staffing levels, this type of operation will continue, that we will continue to require this additional help. In the last 2 years, we've answered, I think, about 3,362 calls for fire and EMS. During that same period of time, we received mutual aid 17 times for fire calls, 23 times for EMS. During that same period of time, we provided mutual aid 4 times for fire calls and 16 times for EMS. So we don't just receive, we do manage to give as well. I'll talk a little about the Insurance Service Organization. This is the organization that rates your community's firefighting capability. From that rating, the cost of your fire insurance is determined. We're using the last report as a workbook to improve our system through improvements in communications, training, prevention, and education, and our response staffing, which includes the additional staffing, and our mutual aid. We expect to reduce this rating and save our citizens money on their fire insurance cost. We're very proud of our current operations. I think you can see that we're making great strides to increase safety of our personnel and our citizens that we serve. And now if Chief Bowen can come up here and tell us a little bit about his police first responders. Chief.
Thank you, Chief. Let me just say, Mr. Mayor and Council, Mr. Wheeler, thank you for asking me to come here tonight and talk a little bit about that, because it's important that the citizens understand that in Poquoson, and to borrow from my good friend, the fire chief, it is the place where public safety, that term makes more sense than police and fire, because we work together so often. Before I talk about how we support medical services, let me just say it was earlier this year where one of my young officers on night shift, in the attempt to arrest a felon who had stolen a car and was in the city, was attacked by this individual and was in a fight and couldn't get on the radio to announce his location. It was members of the EMS service who first got there to assist him. And it's because we do dispatch calls simultaneously over both channels. And that's the first step to our support, is that they know what we're doing and we know what they're doing. It's not many jurisdictions that you go to where medical calls are given out routinely over the police radio, but that's what we do here. That's the first part of the first responders program. We know where they're going and what the nature of the call is. In that vein, we provide an opportunity for members of the police department who have the aptitude and the desire to do medical work to get a basic ENT certification. If they do that, we do pay them a stipend for that. And then they're on the street able to use that skill in a way to support the EMS service, because since our guys usually are in the car out patrolling, there's the potential that we may get there even quicker than the fast response times that we have from the fire department. So we have a higher level of care that we can immediately provide while we wait for the advanced life support capabilities of the EMS service to get there on the scene. Currently, 6 of our 24 full-time members, 16 in patrol, are certified basic EMTs. A 7th has completed the course, has not passed the final certification test yet. But even beyond that, from the beginning at the academy, they get CPR training and they get basic first aid. So having someone there who has the presence of mind to evaluate and assess a situation, who has the availability of a radio communication to communicate critical information back to the fire department prior to their arrival and to the dispatcher, and to intervene in a way that can provide some level of care prior to the arrival of an ambulance is critical, and it's a way that we work together. So we call it the First Responders Program, but it's just our efforts to make sure that the citizens of Poquoson get the best service possible and the highest level of care as quick as possible by supporting our comrades, our employee, our good friends at the fire department, by trying to get there as quick as we can and help them and prepare the way so when they get there, they can do the things they need to do, and they can get a quick assessment from the officer who's there who can tell them this is what's going on. So sometimes, that's a delay when you're trying to ask questions and find out what happened, because it's very difficult to apply some type of care when you're not sure exactly what precipitated the event and what the injuries are. So the officers can do that and ask questions and even get some vital information, so when the medics walk in the door, the officer can brief them, and this is what we found, this is what's going on, and they can, in a very quick fashion, they can start to provide the appropriate services without having to go through that process again, because we've already done it for them. So it's about working together. So public safety is the key, and as well as much as we can to try to support the EMS services and provide the citizens with that service. The fire department and the EMS service works with us and together, and it's truly a public safety effort, not just a police or a fire effort. And I'm very proud to be a part of that, and I think a big part of that success is the relationships that we have between members of the fire department and members of the police department. I think that we work well together. I think it begins with Robert and I setting the example, and I'm proud to call him my good friend and to be a part of helping him and him helping me and working together. So thank you for the opportunity to speak, and appreciate that.
Chief?
Yes, sir.
I know you've got sitting there the number of first responder responses. If you could share that, please.
Sure. I was looking back. We include this in our performance measures during our budget season, but I'll just go over these numbers real quick, and they're done in a fiscal year format. These are the first responder calls that we actually took as part of the medical information that comes out over the radio. FY 214, we handled 300 of those calls. FY 215, 352. FY 2016, 399. And since July 1st, we've gone on 167 calls. And again, it's just an attempt to try to provide intervention of the highest quality as quick as we possibly can to support the fire department's emergency medical services and to give the citizens a service that we think they deserve and they need. So.
All right, well, I thank you both, and I applaud you both. I mean, the way you guys work together has always amazed me. Okay, so are there any questions of council concerning this subject?
I've got it. I have a couple for the fire chief. Just on terminology, you talked about EMTs and paramedics. Could you very quickly tell me the difference, please?
Well, the EMT is the most basic level. The EMT intermediates and the paramedics are the ones that push the drugs and can perform certain functions on their own without direct medical direction from the hospital. It's a higher level of certification. We strive to provide that on each and every call.
Okay, and EMT is?
EMT is just basic
Very
level
basic.
emergency
Okay.
medical technician, yes.
Okay, and my only other, it's more of a comment than a question. Taking the numbers, the number of calls you provided over the past 2 years and the number of calls you had to get assistance on, that came out to be 1.1%
That's
that
about
you
right.
had to have assistance.
That's right.
So just wanted to make that clear.
Yeah.
Okay, thank you very much. Any other, oh, you've got a question? Sorry.
Do any of our first responders have defibrillators with them?
Yes, we have several of them at the station. They check out and take with them on the road, and those are serviced by the fire department, and they facilitate us purchasing those. So we have the same equipment they have.
And not only do we have that type of equipment in our medic units, but myself, Deputy Chief, we have them in our vehicles as well, and they are in various locations.
All right, anything else? Thank you, chiefs.